Chapter 4 Video Response. Suppose you have been hired by a sleeping clinic to formulate a questionnaire for evaluating patients' sleep habits. List 10 questions you would include in your questionnaire. 1. Do you go to bed at the same time each night? 2. Do you drink any caffeinated beverages close to bedtime? 3. Is your sleep environment free of distractions such as pets, cell phones, computers, or televisions? 4. Do you take naps? 5. Do you have a snack or eat close to bedtime? 6. Do you awake during the night, and if so, how many times do you usually do that? 7. How long does it take you to fall asleep? 8. When you wake up in the morning, do you have a headache, sore mouth, or dry mouth? 9. Have you ever had a sleep study before? And 10. Have you ever used CPAP therapy? Second question asks, Luann is a full-time student who wants to find a way to keep up her class schedule while working full-time. She decides to work the 11 p.m. to 7 a.m. shift at the hospital and then attend morning classes. After her classes end at noon, she intends to sleep from 1 p.m. to 7 p.m., at which time she will get up and study until it is time to leave for work. Based on what you have learned about the circadian rhythms in this chapter, what kinds of problems do you think Luann will encounter in trying to carry out her plan? I stated she will definitely have issues with sleepiness and getting her tasks accomplished with full effort. She will begin to become constantly more and more tired until her sleeping pattern is realized. Her ability to perform a wide range of tasks will suffer, and she will also have issues with higher blood pressure, or she could have issues with higher blood pressure, irregular heartbeat, and decrease or a high increase in her appetite. Her sensory acuity and even her body's response to any medications that she's on at the time could become problematic. Question number 3 asks, you have been asked to make a presentation to 7th and 8th graders about the danger of drugs. What are the most persuasive general arguments you can give to convince them not to start using drugs? And what are some convincing specific arguments against each of these drugs, containing alcohol, marijuana, cocaine, and MDMA, or also known as ecstasy? Honest, open education and communication is first and foremost. Scare tactics and exaggerations of hazards or failure to acknowledge the reasons why people abuse the drugs, pleasure, escape, self-medications, etc. They don't work because eventually the person you're trying to convince will find out the truth and thereby undermining you and your arguments. If you are undermined by a drug dealer or user who is seen as more truthful than you are, then you have really messed up. If they need relaxation and escapes, then you have to find something healthy to work better than the drugs. That works better than the drugs do. That will take work, but it's worth it. And life will become much better for them. If they think it's cool, then let them meet a washed-up junkie. It only looks cool before the problem starts. And for the specifics, there are several health risks associated with drinking too much alcohol. These include anxiety, sexual difficulties, such as impotence, slowed breathing and heartbeat, impaired judgment leading to accidents and injuries, loss of consciousness, suffocation through choking on your own vomit, and potentially fatal alcohol poisoning. Drinking heavily also increases your calorie intake, and it is frequently associated with obesity. Marijuana increases your heart rate by 50%. Frequent use can lead to the possibility of damage to heart rate or heart, such as heart murmurs, heart attacks, and stroke. People with high blood pressure or other heart problems are obviously at higher risk than a healthy person using marijuana. The reality of cocaine hits after the high. Cocaine has powerful negative effects on the heart, brain, and emotions. Many cocaine users fall prey to the addiction with long-term and life-threatening consequences. Even occasional users run the risk of sudden death with the use of cocaine. The evidence is pretty clear, but there are two things to know. The more you use, the worse off you are, and if you use ecstasy along with other drugs, these issues are compounded. A large body of literature has established that ecstasy use is associated with impaired short-term memory function and that this impairment is related to total lifetime ecstasy consumption. Ecstasy use reduces cognition by reducing levels of dopamine and serotonin in the central nervous system, resulting in cognition impairment, particularly in complex cognitive skills, as well as causing disorders such as mood changes, hallucinations, altered perception, and memory loss. Enough said. Those are my video response for Chapter 4.